Thank you very much, Mr. Chairman, for holding today's hearing. I would like to welcome and thank each and every one of you for being here today. In particular, I want to thank Ms. Brown for telling us about your family. Your story is a very moving one. It is unbelievable to me what you have been through. I know many people across America experience struggles similar to yours, and I thank you for sharing your personal story. It's not easy. It's not easy to do. A story of caring for a loved one, for your mother. Ms. Brown, Dr. Brown, we know that 60% of all caregivers are women. And we know that for low-income women, caregiving is associated with an increased risk of poverty. Ms. Brown, as a Black woman, studying to be a doctor, taking out loans to care for your mother, may you share more about the challenges you face?
Hi, thank you for that wonderful introduction to your question. And yes, in terms of the challenges that I faced, in addition to the financial strain, there's also the challenge of being concerned about my future and having my future put at risk multiple times over the course of my lifetime because of the gaps in healthcare. Another big challenge has just been with my family. All of us have had to make sacrifices, and all of us are very concerned that we don't have a way forward. Does that help answer your question?
Well, if you care to elaborate more.
Sure, okay. I mean, as I had mentioned in my statement, most recently I've had to consider withdrawing from medical school. I think that consideration should not be anything that anyone should have to work through, especially since I worked hard my entire life to pursue this goal and hopefully to make a change. So I do ask for everyone to at least think about your own children or the young people in your life whom you want to see succeed. And I think we need to do more for young caregivers like me.
Well, thank you. Dr. Lynn, how could Congress ease the burden for others who are in similar circumstances? What can Congress do? What can we do?
Congress has authorized the first year of developing a community care corps that would organize neighborhoods to help out. We only have the funding for the first year, so you could appropriate and authorize funding for the National Community Care Corps, which would provide infrastructure and instruction and so forth, not much money, but much more local innovation. We also could start supporting caregivers. The federal requirements for certification of electronic medical records does not yet even require a slot for identifying the caregiver when the person is in a medical situation. Can you imagine having an electronic record that didn't identify the parents for a child, and yet a dementia patient or a person with severe disability could be in a hospital, and the caregiver's name and identity is not even in the record? How blind can we be? We have caregivers who have no income, who are impoverishing themselves. We have an example of impoverishment that goes down generations. It used to be that people burned their mortgage before they retired. They had a pension and Social Security, and their kids got their legacy. Legacies are evaporating in long-term care. So we need to have ways to protect the caregiver. Many countries give a caregiver credit toward their Social Security. Many countries give at least poorer families a stipend for doing caregiving. We do none of that. It is as if we plot to make it difficult to be a family caregiver. Very few employers give flexibility to family caregivers, so they end up losing their jobs because they had to suddenly go home when an aide got sick. So we need to really acknowledge where we are in having a very large number of people who need that sort of support. And the changes are in a number of ways. Many of them are not terribly expensive. They are confronting what it is we need to do. What would help Ms. Brown's situation? Obviously, there ought to be a way in which she didn't have to give up her future and her education in order to take care of her mother.
Thank you, Dr. Lynn. My time is expired. Thank you, Mr. Chairman. I yield back.
Thank the gentleman. Let me recognize